Health news, we turn our focus to one of the most commonly diagnosed digestive disorders, irritable bowel syndrome, or IBS. Local 10 medical specialist Kristi Krueger looks at how a South Florida doctor is helping patients get to the real root of their problem and find relief.
Eating should be enjoyable, but that wasn't always the case for Deborah Perlman.
3 or 4 years ago, I started having a lot of bloating and discomfort and all of that.
Visits to 2 different specialists led to a diagnosis of irritable bowel syndrome.
And they gave me medicine. And it didn't really help.
She shared her concerns with her cardiologist, Dr. Adam Splaver, who recently became certified in something called integrative medicine.
He was looking at me, my whole body, not just the cardiac or the GI or whatever.
More recently, we've been finding reasons why these patients may be having these symptoms, and by digging a little bit further, we're able to actually get the root cause and actually treat and make these patients feel a heck of a lot better.
When imaging studies come up negative, Dr. Splaver recommends a specialized test that can look for things like parasites, yeast, or even bacteria overgrowth.
And many times we're able to identify those causes to help with their symptoms and maybe even cure them of their quote-unquote IBS.
Turns out Deborah did have a bacterial infection, which was treated with antibiotics. Allergy testing also revealed she had several food sensitivities and now knows exactly what to avoid.
I am basically pain-free, and I every day would be bloated and feel uncomfortable every single day, and I don't have it anymore.
Now, in some cases of IBS, bloating, diarrhea, constipation, even abdominal pain can actually signify a more serious problem, including bowel, stomach, and ovarian cancer. That's why it is so important to press for answers if standard testing and treatment doesn't really ease all your symptoms. With your health news, I'm Kristi Krueger, Local 10 News.